I'm Julia Bassett, System Manager for Community Health and Benefit, also the Director of our Food is Medicine program. Back in November of 2020, we were connected to Project Hope. Together, we fed over 275 families on that day. We had a chance to pray together. I never saw how powerful it could be to see a Greek pastor come together, hold hands with the community, and say a prayer over this community and feed folks that really needed the support. And so, how powerful that was. And then we did a boatload of food distributions in the community during the holiday season. So, from October the 20th up until Christmas of 2021, we did a number of distributions. At Rush University Medical Center, we've been able to launch 2 pantries on site. We are planning to open up additional food pantries across the city of Chicago. One specific at Rush Oak Park Hospital, hoping to launch that by June of 2025. We're also hoping to launch a pantry at our neighboring hospital, which is part of our system, at Rush Copley Medical Center by June of 2025 as well. I know for certain that Project Hope will be part of this process and part of this initiative going forward. Because of this partnership, our patients have now seen lower numbers with their A1C, as well as being able to manage their diabetes. Many of our patients have also been able to wean off of some of the medication that they currently are utilizing for diabetes. For our patients that are hypertension or have hypertension, their medication that they currently are using has changed in terms of milligrams that they're taking, and then their numbers have whittled down quite a bit. So they are seeing quite normal numbers, if you will, something that they've never seen before. And I have to say that Project Hope has a lot to do with this, because the foods that they are getting in the pantry on the shelf, as well as the fresh fruits and vegetables that we are pulling in from our different resources, has been a tremendous support for those patients in particular. What surprised me the most about this experience is that there's still a very big dedication from Project Hope. Initially, I thought that this would be a one-time experience, and I'll be completely frank with you. Having that one distribution in November, I assumed that, we were going to come together that one time and that was going to be the end of that. But I have seen that grow tremendously. It hasn't been just a one-off where we're doing one distribution. We're doing multiple distributions within the year. That's number one. And then secondly, their support has been just incredible throughout this process. I can send an email to the Greek Metropolis and say, I need support from the parishes. Do we have any additional shelf-stable food that's available that we can get, because we're seeing an uptick in our patients? And I don't get any pushback. It's, Julia, when do you need the distribution? When do you need that donation? And I get that support. Again, we are getting support on December 14th of this year for our pantry, because we were running really low on some of the shelf-stable food. So on the 14th, we have the opportunity to pick up over 40,000 pounds of food. And I'm really excited about that, because through the holiday, through the middle of next year, we'll be able to support our patients with the food that we're getting directly from the parishes.